Report going.
Last night.
What's going down, team?
Starting a Zoom meeting too.
Nothing too crazy.
I didn't finish watching the game because I left.
Corner here.
Can you guys hear me?
In there.
Yeah, Jill, you can hear me? All right.
In here.
All right. Well,
Kelly.
looks like Kelly's absent, so we're gonna go poof, mute her because I can hear my dad. So let's go with Lisa. What's good in your life?
Well, I'm feeling better than last week. I got some kind of bug.
Right, Mr.
Not COVID though, as
Oh.
far as I know. But anyway, I think I'm better now, but still kind of a little blah. So,
Well, you know how I like to have fun and I like to joke around, right?
mhm.
I almost got myself in trouble yesterday because I was doing a telehealth visit with a individual that had a concussion and his mom was on there too. So he's like 16, she's like maybe 50. And I was explaining to him that the best thing to do is to go onto my podcast and to listen to Bear Brooks when I interviewed him in here about his experience with a concussion.
Mhm.
So I said, this one, it looks like it's episode 8. And the article title is How to Guarantee a Safe Return After a Concussion and How to Nix Menopause Symptoms. And then I turned and said, there might be something for both of you there. And as soon as it came out of my mouth, I went, please laugh, please laugh. It was one of those moments where I went, Rob, where's your filter? Stop it. But she thought it was funny, so it was good.
The kid could well be experiencing menopause. Because if he identifies as a middle-aged woman,
You know
then
what?
he will need some help with menopause.
No, well, that explains why I got the hot flash after that.
Yeah, right. Yeah.
Yeah, no, that's good. So, Cindy, what's good in your life?
Oh, things there are moving around up here. So you're getting their road in. So the kids have been around a lot and just tons of work to do. And everybody's just busy and going. And it just feels good to be outside and doing stuff and seeing progress. And
Good. I like it.
yeah.
Good. Yeah. Having sunshine yesterday was really nice. So that was good.
Stuck in here most of the day. Jill's
Yeah.
outside working right now. So it's killing me not to be out there. Well, kind of.
Yeah. Waking up this morning and there wasn't frost. That was nice. Yeah. Linda Hartman, what's good in your life?
Well, I did my workout this morning,
Oh,
so that's good.
I thought you looked a little bit stronger today.
Yeah. No, other than that, I'm here and waiting to see what's good to come out of your mouth.
Oh, yep. Hey, that's a 2 for 2 for me today. I'm going to go home early today because my first patient today, I've always seen her in here, but I've never worked with her. And I got done and she said, it is just a real honor for you to work with me today. And I went, yes, I'm done. It's only going downhill from here. So yeah. So now you're sitting there telling me you can't wait for the goodness to come out. Oh, yep. 2 for 2. So kind. I like it. Linda Hall, what's good in your life?
Am I muted? I think I'm muted.
No, we can hear you. I'm just messing with you.
Okay, great. What's good? Well, I'm getting ready to go to New Mexico next week to watch my oldest granddaughter graduate from college.
I love it. You said
I know.
New Mexico?
Yeah,
Sweet. Good
I
deal.
know.
I like it.
Seeing grandkids is always a good thing.
Yeah, I like that a lot. So, Kathy, what's good in your life?
It was wonderful today. I didn't realize the farmer's market was open today. I was driving down the street and almost ran over somebody. Whoops.
Wow.
And so I think the farmer's market's just wonderful. I just love that we have that in this area. And so that was a wonderful, wonderful surprise.
Good. They're back to business then. That's good to know.
Yeah.
Yeah,
Yep.
we'll have to sneak over there ourselves.
Yep. Nice
Uh,
trees. Asparagus was wonderful looking.
Good. Nice. Local produce. We always like that.
Yeah.
Kelly, what's good in your life?
I think I'm gonna mow my lawn here pretty soon.
Oh, so you don't want me to take your mower in?
Well, I do, but I think I want to mow it one time before you do that,
All right.
unless it's gonna take months and months. So we'll see.
Yeah. Okay.
Other than that, I still like your dog.
Good. Yeah, he's looking at me right now. He's 50-50. So I told my daughter this morning when we were driving in, I said, you know what? It just feels wrong where he just has this constant optimism to him all the time, where it almost annoys you, where it's like, just stop with your happiness all the time. Settle it down a little. I know you're excited to see me, just settle it down. So anyways, Jill, what's good? Try that.
All right. I enjoyed the sunshine yesterday. It was very nice. It was actually warm. So not sure how the rest of the week's going to go to finish out softball season, but we'll see.
True.
Got a new pickup. So excited about that.
Did
And
you drive
saving
it
for a
today?
long time. I've had it, yeah, since Monday. We got it Saturday, but
What kind is it?
Toyota Tacoma
Ooh,
2022.
I was just telling
You just
Mel,
pay
I'm
me
like,
way too much money, Rob.
It sounds like the kids
If I
aren't
could
going to
afford
Disney
that
World.
after 6 months of work, man, you're paying me way too much. No, it's been a long time of saving for that thing. So it's finally, yep. So it's fun.
So it
Fun to
sounds
drive.
like the kids aren't going to Disney World this year.
No, we're back down to zeros. Yeah.
Well, all right. Hey,
No,
it's
not
your
this
party.
year.
It's your
It's my
party.
party.
Yeah.
Yep. And if we were to go, we'd probably drive.
Yep. So,
Yeah.
hey, if you're at zeros, that means that you need this job. So, hey,
I need the job for
Yeah,
a while longer.
so we can, we'll just keep this party
You
going.
got the hook in
Yes.
me. Yeah.
Yes.
Yeah.
All right, team. Well, you saw the title today. So we're going over cracking in your joints, particularly your knees, because I get this a lot. I have people that ask me all the time that are like, hey, my knee's starting to pop. Will you feel this? Will you feel right here? What's that mean? And so, that's a common question. I even made a little YouTube video on the popping and clicking in general and what it means. But specifically today, we're going to dig a little deeper into knee cracking, particularly because there's been some interesting studies that have come out to talk more about that knee cracking that you're getting. So is this a sign of osteoarthritis? That's the biggest one I get. Is knee popping mean that there's a problem, but also does it mean that there's arthritis? So the key with this that we're going to come about is we really shouldn't ignore as far as popping in our knees, especially if we're over the age of 40. If we're getting popping in our knees, that's going to be your sign. So let's dig a little deeper into this. A little cracking and popping in your knees, that's pretty normal. Just a click every once in a while, a little pop over here, that's pretty normal. But a recent study finds that it could be a sign that you're at risk for developing osteoarthritis, but only if you're in a certain age group. So they took data from 3,500 people as part of this osteoarthritis initiative. And what they concluded is that grating, cracking, or popping sounds in or around the knee, and we usually call this crepitus, it may put certain people at an increased risk for developing osteoarthritis. The study looked at people between the age of 45 to 79, and the average age of the participant was 61 years old. So of those who developed diagnosable osteoarthritis within a year, more than 75% of them showed signs of degenerative disease on an X-ray. Those same people, however, did not have frequent knee pain, but did have noisy knees when the 4-year study started. So let me give you the cliff notes. We start out there's no pain, and there's, as far as noisiness in the knees. Do x-rays, things look fine. No arthritis. Up to 4 years later, they find arthritis. So essentially what they're getting to is that individuals 45 to 79, those noisy knees could be a precursor to arthritis, osteoarthritis particularly. So essentially they're saying that from this study, that people with noisy knees in this age group, that they're at a higher risk for developing pain within the next year compared to people who do not have noisy knees. That is the biggest summary that comes out of this. Now, individuals that are at a younger age, so below 49, you can't extrapolate any or infer any type of pathology. Usually individuals that are a younger age that have some clicking and popping and pain, there's not a correlation that there's pathology or problems there. We can get clicking and popping in the joint all the time. That doesn't always mean that you have a significant serious injury. Writing of the patella, which is the kneecap, rubbing, certain activities, prolonged running, or just some mild inflammation under the kneecap can start causing that kind of grating sound that I call it the squeaky door, which we call crepitus. And same thing with the pop. Sometimes we have alignment where our kneecap is just shifted just a little bit, and it creates just a little bit of a click in certain things. And I get it all the time from patients that come in and say, hey, put your hand right here, put it right here. And they'll try and manipulate their knee in a way to make it click and pop. My general rule though, is if you get popping without pain, it's usually not a significance. That's my general rule. But what this study is getting at is that if you're getting clicking and popping, even without pain, it could be a precursor to osteoarthritis if you're in the 49 to 79 age group. Let me make sure that was right. I think it was 45 to 79 age group. And again, that average age was 61. So if you're sitting around the 60s, that could be your sign. Okay. Again, not all that noise coming from your knees is essentially bad. If you do have noisy knees, it just might be helpful to start the discussion as far as, could this be a problem? Taking a regular x-ray to all of a sudden look, is there any arthritis? And then following up with that each year to see, or 6 months to see if there's a progression of arthritis could be helpful. So the whole point of bringing this up is not to put fear and anxiety in your lives. It's more of awareness. And that's what we're always looking to do with the 4% Club is to bring awareness. So can we predict problems? Can we predict who's going to have issues? So one caution of this study, the main author's caution, is that the study only looked at people from the ages 45 to 79 during this time frame. So again, those results only speak to them. If your 25-year-old son or grandson is talking about how when they squat down, their knees pop, it doesn't mean within a year they're going to get arthritis in their knees. Okay, there's no evidence that joint grinding or noise associated with future knee arthritis is found in younger people. Okay. And overall, that grinding and that joint noise isn't always known why it's occurring. It's just speculation of alignment of the patella, as well as muscle imbalances, but it's not necessarily known that you're getting it because of XYZ, especially without pain. Okay. So again, the whole purpose of explaining this is more of a pre-screen. So it's something that you could discuss with your physical therapist. You could discuss with your physician that says, hey, I'm starting to get popping in my knees. I never had this before. What precautions should I take right now? And by evaluating the knee itself, what I would do is I'd evaluate the knee and I'd look and say, okay, well, you're getting a lot of restriction. Either your knee's not straightening or it's not bending, or you have tightness to the quad muscles, or you're getting a lot of weakness to your thighs. All of those can play a factor as far as starting to wear the knee down. There's a couple other factors that we're going to get into as well in our second segment when I go over osteoarthritis. But for right now, I wanted to start off with that study. I wanted to get your input. So let me just open the lines real quick, and we'll start with Linda Hall. Just give me your input on that study between 45 and 79-year-olds and noisy knees.
I get a lot of my clients that will ask me that, and I've said, I don't really know anything about that. And they are. Most of my clients are over 40. So that is the age range that I'm seeing. Yeah, so I guess that will give me something to be aware of and tell them they should probably get it checked out.
Yeah. So just to rephrase that, a lot of different things can cause popping in the joint. And one of the things, so when you're talking with your clients, you could look at is, do you have pain with popping? So pain with popping is usually pathologic. There's a problem. It could be meniscal tear. It could be cartilage that is fraying away. It could be a cartilage defect that is now created a loose body that's floating in the joint. It could be arthritis that's now severe. So there's a couple of factors there, but pain is usually a sign you need to get it evaluated.
Mhm.
Individuals that are of that age, 45 to 79, that have popping that wasn't there before, and now it's becoming pretty consistent, that's more of a screening mode. And that's a time where you can have us take a look at them. You can recommend that they see their physician and just mention that they're getting more popping in their knees that they never had before. And from a study that you had seen or heard about, that it can be a precursor to osteoarthritis. So the options there is to start screening through x-ray, or again, I would evaluate them and I would look at the knee and look for range of motion loss. I'd look for strength loss. I'd look at, as far as overall the joint itself, if it's losing capsule mobility. And from that, it would give me a good idea. And the kneecap, I'd look at the kneecap, and all those would give me a good idea of where they're going knee health wise. So part of the reason that we're bringing this up is this month is Knee Pain Awareness Month in our office. So you're going to get a lot of talk this month about knee pain. So particularly a topic like today.
Okay.
Kathy. Let's unmute you.
I thought everybody had knee problems when they got to a certain age. I just thought that was normal. I guess without the pain it is, but I guess thought everybody when they got to a certain age had a certain amount of popping and pain. So I was kind of surprised by that they found that some people didn't, I guess. So
yeah. Well, the key is aging itself is not a precursor to dysfunction. We feel like it is.
Just seems like it, yeah.
It feels like it is, but usually there's it's multifactorial, that there's other areas in your life that have created that. If it was, then we'd say, okay, at this age, that you're going to get these 3 dysfunctions, and at this later age, you're going to get these 3 dysfunctions, and it would be predictable. But as you have certain people that can't hardly walk and have to get total knee replacements, and you have some people that have never had really any problems in their knee their whole lives. So it's really multifactorial. And that's the same for a lot of them, not just knee pain, diabetes, cancer. There's a lot of different factors. If we live long enough, we're blessed to get some of these. Lisa, your thoughts?
Well, I guess I'm lucky. I don't have to worry about osteoarthritis in my knees because I already have knee replacements.
Yes.
So,
yes.
So I don't know, but I still get cracking, and I get weird noises sometimes. Obviously things are, crunching around in there, but so I don't know. Is crepitus, does that also apply to other joints? So if you get cracking and popping in your other joints, is it also called crepitus, or is it called just for the knee?
So the crepitus truly is that grinding that you get. So I call it the creaky door, where it's kind of, that's really crepitus. Just popping in your knee isn't necessarily the crepitus. It's usually that creaky door, but you can get it in multiple joints, and you can even get it in the tendons. It doesn't have to be in a joint. They see it a lot in the wrist because that sheath that goes around some of your thumb tendons, it gets inflamed, and then just moving your thumb, it goes creak, 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 creak. And then you know that there's inflammation in that sheath. So
yeah, well, again, it seems to make sense that if there's noise that normally isn't there, that something is going wrong. There's something that's, you know, there's wear and tear that's being done on the different surfaces. So if you do that too much, it's going to start wearing down, and you're going to get, you know, your cartilage is going to be wearing away, and you're going to be, you know, feeling a lot more pain. So I would say, obviously, if there's a lot of noise, you should get it checked out. So it makes total sense, and that, you know, it affects you as you get past 45, when, you know, you put a lot more wear and tear on your joints.
right. Nope, I agree. Kelly, your thoughts?
Said it's good to be aware of. We all have to pay attention and listen to our bodies. As you pointed out, I don't know, a couple of weeks ago, I've not ever been too hard on my body, so I don't have to worry about these sort of things. So I'm lucky.
Is that why you're like, hey, Rob, could you bring these pellets in for me?
Yeah, something like that. Yeah, because I don't want knees.
I see. You've been saving yourself. Good for you. Yes.
Yep,
Preservation.
absolutely.
I like it.
It's a thought.
And you just played in my ego. Sure, I could pick those up.
Absolutely.
Yeah.
2 at a time. You should see him, gals. He, you know, one under each arm. He's pretty steadily.
Oh gosh, thank you.
Mm-hmm.
Just could barely fit this on my head now.
Yep. But do you have creaky knees?
I have a left one where I can pop it on demand, but it's
From
been
your
like
years?
possibly, but it's been like that for 18 years or so. I remember in my undergrad education, sitting there going, click, feel that right there. What is that? So yeah, but my knee health has been pretty good.
Good for you.
And who are we missing so far? Cindy.
I just thought you were skipping me on purpose.
Never. It's pure entertainment.
I got to see Kathy yesterday. I met her at the feed store. We bumped into.
Really?
Geez,
your Zoom buddy, your
I know.
4% Zoom buddy became real.
I know. I said, you are real. It's not a cardboard cutout that he puts in front of a camera to make it look like there's people.
It's like, that's what your lower half looks like.
Well, it kind of sounds like I'll have to have you look at my knee.
All right.
Since the dog took me out. It didn't used to make noise or hurt, but now it kind of does both. So
Okay.
maybe I
break.
There's been nagging me to do it, and I just keep saying, yeah, it's gonna get better. It's gonna get better. It's been about 3 weeks now, and it's not all better. So
Well, we've got enough history with those knees, so you know that we're not immune to them.
Probably gonna have to break down and do it. Honey, that just gave me a hot flash. Just the thought of working on a knee.
Yes.
Your goal has been met.
Yep. I'll send you that podcast. Jill.
Well, I was going to ask the question, in that study, what is the past activity of those people that were in the study? So like you mentioned, being an athlete or whatever.
Yeah. So this was, they do different levels of studies, and some studies they do randomized controls where they take a certain population, and based on the strength of the study they need, they'll say, to prove this, we need this many participants. And that's more of a statistics formula. And then they have a control group that they randomize and they put it against, and then they come out with data. This is more of a longitudinal study, which doesn't create cause and effect. It just creates association. And it's, so the results have to be taken under context and see if they have face validity. It's kind of like looking at ice cream and drowning. Well, in the summertime, ice cream purchases and usage goes up, but also does drowning. So does ice cream cause drowning?
Right.
No. But you could see in a longitudinal study, there's an association there. So we do have to look at the face validity of it. And essentially with 3,500 participants over 4 years, it's a longitudinal study that's just looking for associations, but it doesn't get into the specifics of, yes, you did this in your life or you had this issue, and it's more of a long-term. So,
Yep.
but these studies are great because then it opens the door to say, ooh, let's dig deeper. And that's where
Right.
they grab smaller subgroups and test them randomly. So yeah,
Sounds
good
good.
question. All righty, so let's get into osteoarthritis. So what we're really talking about is advanced osteoarthritis. And I wanted to hit on this a little bit because with that study, it kind of opened the door to arthritis. What does it mean? What are we looking for? Lisa had already mentioned that she's got knee replacements, so she knows. And actually, it just reminded me to answer your question that you were talking about is, or maybe it was a question I thought you were going to ask, which has to do with knee replacements and why you still get noise in there. And the joint itself with the knee replacement isn't perfectly congruent anymore. It's essentially plastic and metal hitting each other, and there is a little bit of play to it. So you're going to get some clunking and some clicking. Doesn't mean there's a problem in your prosthesis at all. Just it's expected. Sometimes people hear it with walking and they hear it click, 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 click. And that's just part of the mechanics of now a metal, non-organic, joint in your body. So, but no problems there. So osteoarthritis, when we're looking at that, this is not like rheumatoid arthritis. Rheumatoid arthritis is an inflammatory effect that's systemic throughout the body. Osteoarthritis is really specific to a joint. And if you have osteoarthritis in your finger, that doesn't mean you're going to have it in your elbow. That doesn't mean you're going to have it to your knee. Osteoarthritis is really specific to one particular joint based on wear and tear. And I use the fingers because it's really degeneration. It's a degenerative joint disease. That's all osteoarthritis is. So based on how it's worn down, you'll get arthritis in that joint. Now, if you have one tire that's super low and all the rest are pumped up, well, that tire over miles and miles will wear quicker than the other ones. That doesn't mean the other tires are going to get osteoarthritis, but that tire or go bald, but that tire might go bald and start rubbing in a certain area, and the pressure that's put on it makes it wear faster. And then eventually it might get a hole in it. That's similar to osteoarthritis. We're getting wear and tear from some biomechanical malfunction over a long period of time that leads to degeneration. So when we're looking at osteoarthritis, that's truly where we see it the most: the hands, fingers, in the wrist, knees, the hips, shoulders, and low back and neck. So all of those mobile parts of your spine, so the upper part of the neck here, the lumbar spine, we always see arthritis in those, the degeneration. The hips are weight-bearing structure, and the knees, weight-bearing structure. We usually see those a lot. And then the shoulders, we see a lot too for people that use their arms all the time. So carpenters and individuals that are constantly hammering or carrying things. But also the hands and the fingers for people that are constantly pulling, gripping, typing. Over time, that wears down the joints as well. So when we look at arthritis, we're really classifying it into progressive degeneration of osteoarthritis. And there's the progressions from mild to moderate to severe. And what we're really talking about here is severe. Severe is not something to mess around with. That's where you're really disabled overall. When everybody here could have an x-ray of their back or their shoulder or their ankle or somewhere and probably have some level of mild arthritis. So when people come to me with their x-ray and say, geez, look at my x-ray, it says I have mild degenerative joint disease, I just rip it out of there and throw it away. Because if it's mild, it really doesn't mean much. It has to correlate to your symptoms. If you have mild degeneration to your knee and you've never had knee pain in your life, I'm not going to get too carried away. When you see the word severe, there's no mistake in it. Most likely you're going to have problems. And that's when it starts perking my ears as a provider. So when we're looking at severe or advanced osteoarthritis, This is where your cartilage has completely worn away or near completely worn away. The space between your bones in your joint is much smaller than it used to be. So whether it's the disc heights or the space between your knees, your knee joint, that space is shrunk. Your joints may feel warm and inflamed all the time. They might just be warm to the touch because they're grinding away. They've got an inflammatory issue. The amount of fluid that lubricates your joint also decreases. So the overall size and space of that capsule is going to start shrinking. The amount of fluid, that synovial fluid that makes it mobile and smooth, it can decrease. But that can also be a result of joint swelling. So that inflammation can cause more swelling, which creates joint distension, so expansion. That distension is usually why people get pain. So the knee pain that you're getting if you have swelling, there's a good chance that's the reason. It's actually the distension of the capsule. In severe osteoarthritis, you're going to start seeing bone spurs. So you're going to start seeing lipping. So let's take the knee itself, and you've got the flat part of the joint, and you might start getting lipping that's occurring. So little bits of spurs that start sticking up around the joint. The bones themselves might start rubbing together. You look at an x-ray, it might just be bone to bone, or it might, instead of having a space, it might be angled, and in one area, there's a contact point. You'll most likely have pain and discomfort when you're moving the joint, and that pain might just prevent you from performing your normal daily activities. So the question is, how quickly does osteoarthritis progress to severe arthritis? So how quickly, if you have mild or moderate arthritis, how quickly does it progress to severe? Now, obviously, we can't just crystal ball it and say it's going to take 6 months. The reason is because there's quite a bit of factors. So the key for you is to know what are the factors. So that progression of osteoarthritis depends on a number of factors, and here they are. One, how severe your symptoms are when it's first diagnosed. If it's pretty severe to start, it's progressing fast. Two, which joint has osteoarthritis? Your shoulder and your wrists and your fingers are going to progress at a different level than your weight-bearing bones, such as your hips, your ankles, and your knees. Three, your overall health is going to be a huge factor, because there's a couple of factors that we're going to get into in a second that relate to your health that progress your osteoarthritis. And then how much you use that affected joint will progress it quicker. So when we're talking about those weight-bearing structures, unless you're in a wheelchair, you're constantly moving. So they looked at a review of 30 different studies that found that osteoarthritis of the knee progresses more rapidly in people who, again, here are your factors. So people with osteoarthritis are going to progress faster with these three factors. One, we're older. There you go, Kathy. People that were older, they progress faster with osteoarthritis. Number two, they had a high body mass index, so their BMI. Now, BMI isn't always a great indicator of health, but it just is an association of mass. If the more that you weigh, it's just adding stress to your lower body joints. And the third factor is if you had osteoarthritis in more than one joint, it's most likely going to progress faster. So those three are important. They're important because an early diagnosis makes it possible that you can start slowing the progression of osteoarthritis by following a number of lifestyle or medical choices. It can assist. Because once osteoarthritis starts, it can take years or even decades to reach that severe joint damage stage. If severe joint damage develops, well, and the symptoms are affecting your overall well-being and your quality of life, then surgery or joint replacement might be your option in the future. So what are some of the symptoms you're looking for that start telling you that you're advancing in that area of moderate to severe arthritis? Okay. Here are a couple for you. Some of these other symptoms that you see with moderate progressing to severe arthritis are a loss of flexibility in the joint. So again, you're getting bone spurs that start poking up that are trying to block the joint. Also, the capsule itself is going to try and limit the amount of mobility to the joint, so it's going to start tightening down. So any individual that is getting osteoarthritis is going to get some level of capsular restriction. We actually call it a capsular limitation of movement. When I do an evaluation on any of your joints, I'm looking for a capsular pattern of movement. That tells me if you're getting osteoarthritis, because they typically will shrink in mobility in a certain pattern. So loss of flexibility overall in the joint, that's going to be one. Number two, it's what we talked about earlier, grating or cracking noise when you move the joint. That could be a sign that you're headed towards severe arthritis. And the third one, swelling around the joint overall. So if it's warm and it's swollen, you're losing mobility, these are all signs that you're starting to get moderate to severe arthritis. Now, if osteoarthritis affects your hands, you might find it hard to do some of your basic dexterity things, grasping, opening a jar, with torque. But if you have arthritis in your knees or your joints, it might be difficult to walk, climb stairs, lift objects. I mean, it's as we know, it starts to really affect you. Dog's chewing on his toy. Just had to make sure it wasn't my chair. What other factors cause osteoarthritis? So let's just kind of hit some of these. There are some genetic factors. There are some genetic factors that increase your chance of osteoarthritis. They could affect your body and make the cartilage or how your bones fit together in the joint a challenge. And that influences how quickly osteoarthritis progresses. So if you have parents that have knock knees or have flat arches, that can put strain on your knee overall, that it affects your overall wear and tear that develops osteoarthritis quicker. Number two, your weight. How much you weigh, that extra weight can put a lot more pressure on your hips and knees. And that causes that cartilage in your joints to just deteriorate faster. So obesity overall can also affect the production of the hormones and the immune system in ways that increase the risk to cartilage damage and the bone joint damage. This also can aggravate inflammation. So the weight and genetic factors can play. There's two. And then the third one is past injuries. And this is what Jill was getting at earlier, is how much does playing a sport or doing different activities cause? Because if you have an injury that, let's take an alignment in a car, you get in a car wreck and it messes the alignment up enough that you don't really notice it. All of a sudden, one tire or one side of the car is wearing quicker. And you don't know why. Everything looks normal. The tire pressure is just fine, but it's wearing that down quicker. And that's essentially what can happen if you have previous injuries, previous surgeries, muscle imbalances, joint limitations that were never taken care of when you were younger. And now you're walking or using your shoulder and doing different things against that movement over and over and over, can create a biomechanical deficit that wears down the joint quicker. So those past injuries, weight, or genetic factors can all play a significant progression. So let me just round this out. What can you do today? Okay. What can you do today to help slow the progression of osteoarthritis? Let's say that you have popping in your knee. You're worried about the symptoms overall. You're worried that, hey, I'm 55 years old. I know that that the precursor to arthritis is cracking and popping in the joint itself, in the knee. So if we want to be proactive, what can you do? Okay. Number one, weight management. Starting to take pressure off the lower body overall is huge. And it will help decrease inflammation overall. So that's number one. Number two that goes with the weight management is regular exercise and also stretching. Now, the regular exercise overall and the stretching can improve the flexibility to the joint. It can relieve stiffness to the joint, and it can improve your overall physical condition. So the regular exercise and stretching can be critical. The third one, hey, let me get my promo in, physical therapy. So physical therapy overall, we're looking to take any ailments that you're having around the knee, around the hip, around the ankle, looking at the biomechanical factors of them. It could be something related to the biomechanics. It could be an insert, could be an orthotic we need to put in there. All these play a factor. So we're looking at that from as a whole, and then we're looking to provide interventions to take care of them to the joint mobilizations, stretching to the muscles, strengthening to the hip, strengthening to the core, could be the knee itself for strengthening or other. The fourth one you could do, supportive devices, such as braces, splints, kinesio tape. That's a supportive device. All those help you stay active and reduce some of the symptoms that you're getting to the knee. And the last one is assisted devices. Okay, Easton. Good. The last one is assisted devices. Can you hear me? Such as a cane or a walker. There's a couple reasons for this, or crutches, one crutch. Just by using a cane, it can almost take 50% of the pressure off your knee. That's a sizable amount. So that means you can walk further throughout the day without the same amount of pain going or weight pressure through your joint. That's huge. But if you just walk the same amount and you used a single point cane properly, I mean, it's taking almost 50% of the weight off your leg or the pressure off your leg. So those 5, weight management, regular exercise, physical therapy, supportive devices, and assisted devices all can help with osteoarthritis. So let me just open this up to you guys and give me your thoughts on that. Lisa, what are your thoughts?
Well, okay, so if you use a cane, I mean, you're you're putting the weight that you would normally have on your knee or whatever, your leg, onto, your hand or your arm. So, doesn't that also cause some kind of wear and tear? Because I mean, you're just shifting the weight to a different joint.
Oh, certainly. I mean, but the key is this, using a cane, using an assisted device is going to be way different because, if you're having arthritis in your knee, you're now unweighting that. But ideally, if you're not going to have the same level of arthritis in your wrist or your hand. Now, if you do, and you have arthritis in your wrist and your hand or your thumb and your knee, well, now you got a secondary problem.
Yeah,
and then we
that's
might,
me.
yes. So then you're looking at possibly loft strand crutches that can take some of that pressure off as well. So that makes it harder, definitely. But for an individual that only has knee arthritis, that's what you're looking at.
Was that just temporary though? I mean, aren't you kind of just sort of giving in and going, okay, I'll just be walking around with a cane?
Well, a lot of times I don't see this giving in. I see this adapting. And the reason I say that is because when individuals come to see me for arthritis, and what I hear all the time is, well, I have arthritis in the joint, and can you reverse it? No. So you can't help me. That's not really true. What if I could take away all the pain that you're having and you could do everything you want in your life and you're not having any problems? Would you be okay with that? Or is it only because mentally it says that I have arthritis? Because people can have arthritis in their joint and have zero pain and zero problems. So the key for us is when we look at somebody, what's affecting this? And sometimes we have to get inflammation down. And the best way to do that is to add an assisted device to take pressure off of it. Might be joint mobilizations to the joint to help add the normal mechanics back to the joint itself. That might be a flexibility issue to the hip or to the knee that's affecting the ability for the knee to go through the full range of motion. And by correcting those issues in the long term, then we get greater mobility, less pain, and they could do more things in their life. But the best place to start is by getting pressure off of it, because nobody wants to stop walking. Nobody wants to sit in a wheelchair and have somebody push them around. So using an assisted device temporarily can help. So yeah, good question. Cindy.
I'm still just sitting here sweating.
What are you sweating over?
The thought of somebody touching my knee.
I guess we'll have to do a telehealth.
Yeah, I mean, I'll have to I'll just think about that. Maybe it is in my head. I don't know. Maybe I'm that person. Just
Okay.
saying.
All
And
right.
you have to switch to wine bottles with corks if you have arthritis because you can't do the screw top anymore. That's
Yeah. Well, do you have that automatic uncorker where you put it on there and just
yeah.
That's where it's
I do.
at. That's where it's at.
Awesome.
Yeah. So the question I have for you, do you have a mini wine fridge?
I used to, but Joe didn't put a vent in the island when he built it. And so it got too hot and burnt up. So it's his fault that I don't have one now. So he has to give me dedicated space in the refrigerator now.
Okay.
So
I just figured in the garage there'd be now a full.
that's where his beer has to go.
Oh. Well, I see your guys' priorities. That's good.
We work it out. We
Yeah.
work it out.
Which is number 6 on the osteoarthritis is proper use of alcohol. All right. Kathy, what do you got?
Well, I think the big thing is that it just made me realize maybe when I go for a walk on my knee hurts, I need to take my walking stick.
Yes.
And I just hate walk, especially when I have a dog in each hand. It's hard to use a walking stick. But when I don't have the dogs, I really it's easy to do. I just don't think about it, I guess. But I didn't realize I didn't realize how much difference the pressure would be. I didn't realize that.
And it's going to help a little bit with your balance too, so you don't have to use it as much. Just make sure that if, let's say your knee is hurting on the right, you use the walking stick on the left.
Opposite of what's hurting.
Whatever's hurting.
Okay.
And that way,
And
as you're putting weight on that right leg, you're pushing down the left, which helps unweight the other side.
And if you have a broken, say, wrist, or you fall over your dog, like Cindy was talking about, or whatever, and you do get a break or an injury, does that predispose you to faster arthritis? Did the injury make it come faster, or is there any correlation there?
It could. So let's say you broke your wrist, and when it healed, they looked at it and said, you know what, we don't want to go in there and re-break it and straighten and put a rod and pin in there. So we're going to leave it as is. And it's a little bit angulated. So now when you're using it, the mechanics is a little bit off. So then it rubs a different way. Same thing. If they came and put a plate on and now all of a sudden it's limited and you can't use it the same way, that can speed up the process of developing arthritis in the joint. If it heals normally, naturally, and just how it was ahead of time, the risk isn't there. It's just a matter of what the consequence is.
Okay.
Good question too. Good questions today. Linda Hartman.
I don't really have any. I never had any joint issues. I did have a meniscus repaired at one time, but that's been 16 years ago.
Okay.
The surgeon said he would see me in 10 years. I proved him wrong. So,
Yes, you did. Good.
but otherwise, I'm a little bit stiff trying to get on the floor or get back up. But other than that, I'm doing good.
Good. Yeah. And a lot of times when they take a meniscus and they go and just trim it out from a tear, because usually after the age about 18, they don't repair them as much because of blood supply issues. So they usually trim that right out of there. And that usually leads to arthritis in the future. So that was his prediction. And you just buck the curve. Good for you.
Well, I purposely try to be careful how I don't jump anymore, of course, and just try to be careful lifting or anything that would put pressure on that area. So,
well, it sounds like you've done a good job as far as being on the Kelly program of just having your son-in-law do all the lifting.
Yeah, that's what you do.
Yeah, it's a good strategy. All right.
All right, I've got to leave this. I've got another meeting to go to. So
later,
I'll
Gator.
see everybody.
Linda Hall.
Okay. man, this really hits me. I didn't realize what I had was osteoarthritis because all they said was you have bone on
Oh,
both knees. And that was almost 14 years ago. But what has helped me, and I hate to be a cheerleader again, I'm not really trying to do that, but
Jill, get a close up.
Pardon? Oh.
Jill, get a close up. Get ready.
No, but this is what happened. I could barely walk to go get my clients, 5 or 6 years ago. And it was really painful. And I had a couple of things done that helped, but nothing really helped until I started to come to your gym. And the reason I started coming to your gym was mostly I was falling. And I was falling because my legs just wouldn't move as fast. And I often joked about if I get up and they yell fire, I'm going to fall over because my legs don't work right away.
Yeah.
But and I did lose weight. That was one of the first things that helped me. I probably lost 50 pounds.
Good job.
And, but this program, Tyler was just helping me last week with pain behind my knee that I didn't ever have before, and just discovered that, I needed that stretching part that I really wasn't doing. But what I want to know during all this is I'm feeling awesome. I can hike, I can dance, I can walk, all the things I want to do. I can even get down on the floor, which I never could do. Am I going to be able to, am I doing any more damage, Rob, that I may end up needing a knee replacement? I mean, that's what they said I was going to have 14 years ago, but I'm not having the pain. I am able to, work out. I don't even know if this is an appropriate question for now, but I mean, I don't ever want to have a knee replacement.
Yeah.
But, and I do use walking poles when I hike, because I use both of them because both knees are bad.
So if I'm hearing you correctly, I'll try and summarize this. You're a prime example of what I'm talking about, is that individuals will come in and say, well, I've got degeneration. There's nothing you could do to help me. And the mindset has to shift that if we could take care of all these other issues and you can live your life the way you want to, are you okay with it still saying degeneration on your x-ray? Because the key for people is they just want to live their lives. They would never get an x-ray in the first place if they didn't have any pain or limitation in their lives. And it's essentially where you're discussing now, is that you can live your life and do the things that you want to. And everything that's helped walk you through to get you there at this point has left you confused now of going, well, do I ever have to have a knee replacement? Am I going to ever need one? And the answer is, if you could take care of those ailments, you keep your body mass index in check, and you build strength around your knee and your hip, there's a great chance that you don't. There's a great chance, but it takes the diligence and the effort and the energy that you put into it to get there. And some people, it's hard for them to get there, but no. So good on you. Good on you. So yeah. All righty. Well, my son's got a dental appointment. So Jill, we'll cut you short. You don't get to give me your 2 cents on knee injuries, and I will catch you guys next Wednesday, if not sooner. All right. See you later.